Welcome, everyone.
Bienvenue à tous. We are delighted to host this virtual celebration of the Canadian College of Health Leaders National Awards Program.
We normally present these awards in June at the NHLC conference, but we're doing the next best thing by celebrating our awards recipients online with a wide Canadian audience.
Nous présentons normalement ces prix en juin lors de notre conférence annuelle, mais les circonstances nous obligent à célébrer nos lauréats en ligne avec un nouveau format cette année.
For those who normally attend the celebration in person, this will look a little bit different. Actually, I think it'll be a lot different because for many of us, especially the women in the audience, we won't have our gala dresses, but hopefully next year. We certainly appreciate everyone's cooperation, and we thank the award recipients and sponsors for allowing us into their homes via teleconference tools.
Through this Honoring Health Leadership celebration, we recognize the contributions of some of Canada's most outstanding healthcare leaders and innovators.
The National Awards Advisory Committee provides oversight and monitoring of college's National Awards program. On behalf of the college, I'd like to express our appreciation to the committee members for their dedication to further improving the college's National Awards program. Thank you.
Merci aussi aux nombreux membres des comités de sélection de notre programme de prix. Thanks to all the Award Selection Committee members.
And thank you to all our sponsors, our nominators, our nominees, and those who have supported the awards program.
I encourage all of you to download and read our 2020 Leading Practices booklet to learn more about those being honored this year and to consider how you and your teams could implement some of the inspirational projects and initiatives in your own organization. Marianne, let's get this show on the road.
The Canadian College of Health Leaders celebrates its 50th anniversary in 2020, an incredible 50 years of providing leadership development, tools, knowledge, and networks to members so that they can become high-impact leaders in Canadian healthcare. While we're celebrating this milestone during these unprecedented times, we're proud of our community of 20 chapters across the country, our staff, and our volunteers, our 3,700 members and 80 corporate members, and our numerous partners, sponsors, and collaborators. Together, we continue to promote lifelong learning and professional development while recognizing leadership excellence.
Nous sommes fiers de l'énorme essor que nous connaissons grâce au succès de nos membres et au travail incroyable qu'accomplissent nos bénévoles et notre personnel. Nos chapitres locaux sont dynamiques et stimulent les membres localement au moyen de divers webinaires et initiatives. Nous enregistrons un nombre record de nouveaux membres et de leaders certifiés en santé. Notre revue Forum Gestion de soins de la santé continue d'offrir des informations stimulantes et qui incitent à la réflexion sur les solutions et les pratiques exemplaires. Et finalement, nous mettons systématiquement en œuvre le cadre de capacité de leadership en santé LEADS dans de nouvelles organisations partout au Canada. As part of our virtual 50th anniversary celebrations, we are very proud to honor the recipients of the 2020 National Awards Program.
On behalf of the college's board of directors and its membership, I'd like to thank 3M Canada and Johnson & Johnson Medical Devices companies for their co-sponsorship of this virtual celebration. We're proud to work with such partners as they provide us the opportunity to celebrate and showcase outstanding individuals, teams, and organizations who make a difference in their communities.
We are delighted to co-present, along with Johnson & Johnson Medical Device Companies, the 2020 Honoring Health Leadership Virtual Awards ceremony. While the current circumstances are preventing us from having a face-to-face celebration, we're pleased to support the Canadian College of Health Leaders to provide a platform to recognize and celebrate outstanding individuals, teams, and organizations. I also wanted to take a moment to recognize all of the frontline workers, healthcare leaders, and healthcare organizations for the work they are doing to battle COVID-19, protect Canadians, and support the global response. We are in this together. 3M has been a proud sponsor and partner with the Canadian College for 26 years, and once again, we are delighted to be recognizing excellence in health leadership. Congratulations to all this year's awards recipients, and thanks to all health leaders for your contributions to Canadian health systems.
Johnson & Johnson Medical Devices Companies of Canada is pleased to co-present along with 3M Canada at the Canadian College of Health Leaders 2020 Honoring Health Leadership Virtual Awards Ceremony. As in previous years, we are proud to showcase these recipients, not just for winning their respective awards, but for making a difference to their communities, their organizations, and most importantly, to the patients and families we all strive to serve. The format of this year has necessarily evolved to this virtual platform, reminding us of the increased importance of strong leadership in healthcare today. Responding to the COVID-19 pandemic has required strong, decisive leadership, as in one illustration, you, our healthcare leaders, made radical changes to sites of care delivery that historically may have taken years of planning and execution. Similarly, it has forced companies like Johnson & Johnson to radically modify our thinking to reduce normal cycle times for vaccine development from 6 years to a mere 6 months, and more on that to come in the future. With our new reality as a backdrop, at Johnson & Johnson, we are pleased to support your ongoing efforts and partner in meaningful ways to advance the health of all Canadians. We offer our heartfelt congratulations to all award recipients. You truly are difference makers.
Thank you for your support. Our virtual ceremony will be divided by award categories. We will start by presenting the college awards and then move on to the sponsored individual awards and the team and organization awards, and then the 3M Healthcare Quality Team Awards. We will then conclude with the Robert Wood Johnson Awards. The CCHL Distinguished Leadership Award honors a champion of performance improvement. Winners of this award are passionate and visionary leaders who have led transformative change, demonstrated exemplary engagement and collaboration, and a dedication to building leadership capacity. Winners of this prestigious award are senior leaders who demonstrate a commitment to lifelong learning, are recognized by their peers for their passion for health leadership, and have made lasting contributions to their communities. Thank you to Stryker Canada for sponsoring this prestigious award.
Stryker Canada is pleased to join the CCHL Awards program as a multi-year sponsor and to support this prestigious award. We are proud to announce that Graham Dixon has been named the recipient of the 2020 CCHL Distinguished Leadership Award. Often cited as the father of LEADS, Graham was the principal investigator in a cross-Canada research project resulting in the LEADS in a Caring Environment Capabilities Framework, the most used leadership framework in Canada's healthcare system. LEADS is now endorsed by health authorities across Canada and by most national health organizations. On behalf of the college and Stryker Canada, we want to congratulate Graham for your outstanding contribution to healthcare leadership.
When Faisal Khashabchi, chair of the college board, phoned me to inform me about receiving the Distinguished Leadership Award, I was both shocked and surprised. I most certainly never saw myself in the running for such an honor. I guess age has given me some perseverance. To paraphrase General George Patton, perseverance is fear holding on a minute longer. Thank you to the college, to Stryker, the sponsor of this award, my nominees, and to my family, and to all of you healthcare leaders out there for the privilege of being here today on your behalf. Please, please keep up the quality leadership you're performing on behalf of our citizens. In closing, I'd like to quote Edith Wharton from the Wharton School of Business, who said, "There are two ways of spreading light, to be the candle or the mirror that reflects it. You are the candle, and I am merely the mirror." Thank you.
At the college, we are fortunate to have many dedicated corporate partners whose membership and support make so many of our programs and services possible. The President's Award is given annually to a corporate member who has at the minimum 5 years of continuous involvement with the college and has supported the college activities and programs in a tangible manner. Le prix du président pour rapport exceptionnel au collège rend hommage à un membre corporatif qui, depuis plusieurs années, aide constamment le collège à réaliser sa mission, sa vision et ses orientations stratégiques. This year, we are very proud to celebrate Hillrom. A global medical technology leader, Hillrom has been a corporate member of the college since 1990. Their primary representative, Michael Hamilton, is a member of the Corporate Advisory Council. Through their financial support, Hillrom was instrumental in the relaunch of the annual CEO Forum in 2019, an event co-hosted by the College and Healthcare Can. Hillrom has a long record of supporting CCHL activities such as national and exclusive HPRS events, sponsoring our BC Health Leaders Conference and the National Health Leadership Conference, and participating in various ad hoc committees. Thank you for your support. Michael, thank you very much for your ongoing friendship and support, and congratulations to Hillrom.
What an honor it is for Hillrom to be named this year's recipient of the President's Award for Corporate Membership. I'd like to thank the Canadian College of Health Leaders for sponsoring the award, and I'd also like to congratulate all of the other award recipients. It's a source of pride for us to be recognized among such a distinguished group of health leaders. My involvement with CCHL began over 20 years ago through a single HPRS event. Since that time, in a career spanning multiple companies, I've been an active participant in many college events. I've learned that, like so many things in life, you get out what you put in. The college creates a unique opportunity for members to build a network for learning and sharing ideas. And when it works well, it leads to the creation of new solutions that help shape the health system. The last few months, as strange as they have been, have demonstrated that partnerships and the sharing of ideas between the health system, industry, and policymakers are more important now than ever. We look forward to continuing to be at the table, working with all of you towards an improved, sustainable health system. Thank you.
The Canadian College of Health Leaders is proud to announce the recipients of the 2020 Chapter Awards for Distinguished Service. This award provides an opportunity for chapters to recognize locally and nationally the individuals or corporate members who've made a significant contribution to their chapter. The recipients have been selected by the respective chapters in the recognition for their involvement in college activities and for their leadership in educational programming, member recruitment, or other areas of volunteer contribution. Congratulations goes out to BC Interior, Gregory Marr, BC Lower Mainland, Dr. Randy Gilbert, Bluenose, Colin Stevenson, Eastern Ontario, Dr. Bernard Leduc, Greater Toronto Area, Taylor Martin, Hamilton and Area, Keith McGlone, Manitoba, Jennifer Spencer, New Brunswick, Nancy Roberts, Newfoundland and Labrador, Maria Rattoni, Northern Alberta, Sandy Cosi, Quebec, Enka Andrea Guerin, South Alberta, Dwight Nelson, Southwestern Ontario, Jennifer Peckett, Vancouver Island, Matthew Miller. The college was pleased to introduce a new award this year, the Healthcare Management Forum Article of the Year Award. Created with the support of Sage Publishing, this award is focused on honoring a journal author whose article has helped to challenge the traditional notions of health leadership and motivate transformational behavior. The Article of the Year Award highlights an original article published in the preceding year, which has helped inspire meaningful reform and contains findings which apply to multiple sectors within healthcare.
On behalf of Sage Publishing, I am honored to present the first ever Healthcare Management Forum Article of the Year Award. The winning author is Gertie May Muse for her article entitled Enabling Cultural Safety in Indigenous Primary Healthcare. One of the most downloaded Healthcare Management Forum articles in 2019, the article was selected because it is a perfect example of how to inspire meaningful reform based on real-world experience. Gertie May Muse is a dedicated and respected leader in Indigenous health organizational development and systems change management, with over 20 years of experience collaborating with provincial and federal governments and First Nation and Indigenous governed health service providers. Congratulations.
Thank you to the Canadian College of Health Leaders and Sage Publishing for this inaugural award. Though we cannot be together in person, it is an honor and privilege to be part of this virtual gathering. As an Indigenous author, I also want to thank the college for publishing my paper. It was intended to amplify the voices of Indigenous health professionals and leaders who are on the front lines of community-governed health centers. These are voices that are often isolated in the healthcare system and absent from the literature. Yet they are creating innovative, and culturally safe and sustainable solutions. At a time when we are witnessing a heightened awareness of systemic racism and its impacts on our society, it is essential as health leaders that we understand how systemic racism operates in healthcare and what we all must do to uproot it and stop the damage it causes. Indigenous and racialized communities have answers for themselves and our societies today. My article focuses on some of those solutions for health leaders. Thank you, and congratulations to all the nominees and award recipients.
The Celebrating the Human Spirit Award recognizes and honors the meaningful contributions of individuals or teams who provide health services for acts of caring and compassion that go above and beyond the call of duty, which inspire others and have a profound and lasting impact. Ce prix reconnaît les actes d'individus exceptionnels qui améliorent la santé ou le moral des patients ou la vie de la famille du patient ou de la collectivité. Ce prix vise à partager leurs histoires avec leurs collègues partout au Canada et d'aider à inspirer les autres. Thank you to Stericycle for sponsoring this award.
Stericycle is not only committed to protecting what matters for our customers, but for our communities as a whole. And that is why it is a privilege for us to present the Celebrating the Human Spirit Award. I am proud to announce that Marianne Murray and Sandy Cossey have been named as the 2020 recipients. They are championing and improving medication safety in Canada and globally. As a volunteer with Patients for Patient Safety Canada, Marianne's relentless focus on clear communication helps ensure patient safety is having an impact. As a determined promoter of patient engagement, Sandy's personal leadership and influence on patient engagement in healthcare transformation are making a difference. Their collective efforts continue to have significant impact on patients, providers, leaders, and communities. Congratulations to you both.
At a time when now, more than ever, we need to be acknowledging the humanity in all of us, I am so humbled and grateful to be recognized by the Canadian College of Health Leaders with the Celebrating the Human Spirit Award. I am especially proud and honored to share this distinction with Marianne Murray, a selfless patient family advocate and partner, and a true health leader. A big thank you from both of us to Stericycle and to the college for appreciating the profound and transformative power of partnering with patients. The past few months have taught us that health leaders need to have resilience, courage, compassion, and a relentless drive to ensure healthcare is as safe as possible, as soon as possible. Marianne and I hope we continue to inspire this human spirit in all leaders.
It is an honor to share this award with Sandy Cossey, a healthcare leader who promotes patient partnerships in Canada and abroad. I would also recognize Patients for Patient Safety Canada, who work tirelessly to include patient stakeholders at every level of our healthcare system. With patient engagement, care is safer and our healthcare system is stronger. Thank you for recognizing our collaborative success and allowing us to encourage others to partner with patients to improve healthcare safety for all Canadians.
The Mentorship Award is presented to a leader in the healthcare system who demonstrates exemplary, sustained commitment to mentoring and inspiring healthcare leadership. Winners of this award are recognized leaders who, through dedicated service, have made a substantial contribution to healthcare mentorship within their own organization or within the health system. Thank you to Roche Canada for sponsoring this award.
I feel honored and privileged once again to present the CCHL Mentorship Award, which Roche has sponsored since its very inception. With our purpose of doing now what patients need next, we recognize that to truly improve our healthcare system, we must emphasize the importance of developing and mentoring our leaders. We are therefore delighted to recognize the contributions of an outstanding leader, Tom Maston, who has demonstrated extraordinary commitment, professionalism, and effectiveness as both a leader and a mentor over the course of his 28 years of dedicated public service in New Brunswick. Congratulations to this year's Mentorship Award winner, the former New Brunswick Deputy Minister of Health, Tom Maston.
I would like to thank the college and Roche for sponsoring this award. Mentorship rarely shows up in a job description, but as managers, it is one of the most important investments of our time that we can make. I have been very fortunate in my career to have had several individuals take an interest in me and spend time with me. I have always felt that the most appropriate expression of gratitude that I could express was to try and pass it on. I can think of no better tribute to my mentors than to have the next generation of leaders benefiting from their knowledge. Thank you very much.
The Nursing Leadership Award builds on the themes of patient-centered care and leadership and honors those who demonstrate an ongoing commitment to excellence in these areas. Le prix de leadership en soins infirmiers met en valeur les thèmes des soins centrés sur les patients et du leadership et honore les personnes qui manifestent un engagement continu à l'égard de l'excellence dans ce domaine. Nous remercions sincèrement Baxter Canada pour leur soutien de ce prix.
Baxter is pleased to sponsor this year's Nursing Leadership Award. Throughout our 83-year history in Canada, we have always been proud to partner with nurses who inspire, innovate, and drive excellence in the delivery of patient-centered care. The recipient this year is a transformational leader and change agent with a long career focused on bringing people and systems together to make the vision a reality. She accomplishes this with an emphasis on efficient, effective, and evidence-based delivery of care that respects the needs and wants of patients and their families. Her commitment to quality patient care, innovation, and leadership in nursing shines through in all her work at the Victorian Order of Nurses and in her volunteer roles. I'm delighted to recognise Dr. Sharon Goodwin as the recipient of the 2020 Nursing Leadership Award.
I am humbled and honoured to be nominated by my colleagues at VON Canada for this year's Nursing Leadership Award from the Canadian College of Health Leaders. The Nursing Leadership Award is made possible because of the generous sponsorship of Baxter, and I wish to thank them for their ongoing support of the award. It is with great pride and appreciation that I accept the award for 2020. Our world has changed so much in recent months because of COVID-19, and there are so many unsung heroes in healthcare right now, including many frontline workers at VON. I want to dedicate this leadership award to every healthcare worker and leader at VON, as well as healthcare workers across Canada for their courage, compassion, and self-sacrifice during an uncertain and difficult time. Thank you for this honor and the continued honor of leading and supporting those who deliver care to people in times of need. Thank you.
The Robert Z. Young Health Leader Award is presented to a Canadian healthcare leader aged 40 or younger who has demonstrated leadership in the effectiveness and sustainability of Canada's health system. Winners of this award have shown leadership growth and advancement in their healthcare career and have demonstrated outstanding vision and leadership that has resulted in measurable improvements within their organization or within the health system. Our sincere appreciation to Aramark Healthcare and Senior Living Services for their support of this award.
Aramark Healthcare and Senior Living is delighted to support and recognize the outstanding achievements of Canada's young health leaders and to sponsor the Robert Z. Young Health Leader Award. We believe it is important to recognize and nurture emerging talent in an effort to positively impact organizational results and the healthcare community as a whole. On behalf of all of us at Aramark, I am proud to announce that Mehdi Somji, who is a certified healthcare executive and is currently Director, Integrated Health System, Partnerships and Health Analytics at Humber River Hospital, has been named recipient of the 2020 Robert Z. Young Health Leader Award. Mehdi is an exceptional leader with a record of accomplishment for delivering many impactful initiatives that have improved and continue to improve the health system. He is a sought-after expert in many areas, including health system integration, clinical operations, quality improvement, technology, and data and analytics. Congratulations, Mehdi, on this well-deserved recognition.
It is such an honor to receive this award. I would like to thank the selection committee and my nominator, Scott Jarrett, our EVP and Chief of Clinical Programs, and an amazing mentor. I really want to acknowledge all my colleagues and the leadership team at Humber. There have been so many opportunities that were made available as a sheer result of the rapid innovation occurring at the hospital. I want to highlight a few of many individuals that have been extremely impactful in my growth. Carol Hatcher, our VP of Clinical Programs, who is an authentic and inspiring leader. Dr. Michael Gardam, our Chief of Staff, who is such a visionary and an expert in complexity science. Our CEO, Barb Collins, I'm constantly blown away by her. She is one of the most remarkable people I know, and I've been so fortunate to learn from her. Beatrice Edelstein, our Program Director of Seniors Care, who I work closely with and have learned a tremendous amount from. There are many others as well, and a big thank you to all my colleagues and friends, and especially my wife and family, for their ongoing support.
The Award of Excellence in Mental Health and Quality Improvement honors a hospital, health authority, community-based program or service, or a leader in the field that demonstrates evidence-informed and sustained quality improvements in the area of mental health and addictions. Les récipiendaires de ce prix ont apporté dans leur système de santé des améliorations fondées sur des données probantes qui ont permis d'obtenir de meilleurs résultats pour les patients ayant des problèmes de santé mentale ou de toxicomanie. Nos sincères remerciements à la Commission de santé mentale du Canada pour leur soutien de ce prix.
La Commission de la santé mentale du Canada est fière de se joindre au programme national des prix du Collège pour 2020. J'ai le plaisir d'annoncer que le lauréat du prix d'excellence en amélioration de la qualité des services de santé mentale est l'hôpital Montfort. Over the past few years, Montfort Hospital has completely reviewed its approach to mental health in order to offer a French-language therapeutic environment focused on recovery. Focusing their strategy on recovery allowed them to look at the individual patient not just as a recipient of services, but rather as a partner on a team from a recovery perspective. Mettre le rétablissement de la personne au premier plan de sa stratégie de santé mentale a nécessité un ensemble d'initiatives qui contribuent à l'amélioration des soins et services. Félicitations à l'équipe Montfort.
Bonjour, je m'appelle Christine Lévesque et je suis chef de psychiatrie du programme de santé mentale. C'est avec une grande fierté que nous avons appris que le programme de santé mentale de l'hôpital Montfort était lauréat du prix d'excellence en amélioration de la qualité des services de santé mentale du Collège canadien des leaders en santé. Je désire tout d'abord remercier le Collège canadien des leaders en santé qui célèbre cette année son 50e anniversaire. Nous sommes heureux de constater que le Collège reconnaisse ainsi les efforts considérables qui ont été accomplis par l'équipe du programme de santé mentale afin d'améliorer la qualité des soins et services offerts. Je remercie aussi chaleureusement tous les membres de l'équipe pour leur engagement et leur mobilisation à l'égard de notre approche orientée vers le rétablissement. Qu'ils œuvrent en hospitalisation ou dans la communauté, ils démontrent au quotidien leur volonté de dépassement. Merci enfin aux clients du programme de santé mentale. Votre courage et votre détermination sont source d'inspiration pour mes collègues et moi. Merci de ce partenariat essentiel à l'évolution de nos approches.
The Energy Environmental Stewardship Award recognizes a progressive healthcare organization that has implemented programs that demonstrate environmental responsibility through the reduction of energy usage, the preservation of natural resources, and effective waste diversion solutions. Our sincere appreciation to Honeywell for their outstanding support of this award.
This is the 13th year that I've had the privilege of presenting the college's Energy and Environmental Stewardship Award. Honeywell is proud to support this award and to celebrate leadership in regards to environmental responsibility and the sharing of best practices. In their submission, the award recipient clearly demonstrated a commitment to minimizing their environmental impact in order to support the health of their patients, staff, and community. Over the past decade, this BC Health Authority has advanced energy and environmental stewardship best practices throughout their entire organization. I'm pleased to announce that Island Health is the recipient of this year's award. Congratulations.
On behalf of Island Health, I would like to thank the Canadian College of Health Leaders and award sponsor Honeywell for recognizing our efforts to reduce our environmental impact and thereby contribute to health and well-being of the communities we serve. In an organization the size of Island Health, it requires a focused effort to champion the cause and this has been done by energy management and sustainability teams. But nothing would have happened if the advice was not taken and put into action by facilities management and operational support services. Finally, it is gratifying and inspiring to have environmental stewardship best practices identified as an objective in Island Health's 5-year strategic framework, as well as the support of President and CEO Kathy McNeil, the executive team, and the board of directors.
The Excellence in Diversity and Inclusion Award recognizes a forward-looking healthcare organization that has demonstrated leadership in creating and promoting diversity and inclusion to improve the environment for its employees and to better serve their patients and the community. Ce prix fait honneur à une organisation avant-gardiste qui fait preuve de leadership en créant et en encourageant la diversité et l'inclusion. Merci à Sodexo Canada, le commanditaire de ce prix.
We are very proud to sponsor the Excellence in Diversity and Inclusion Award. At Sodexo, we live and work with diversity. Diversity is a non-negotiable, but inclusion is a choice. This year's award recipient is recognized as a leader in advancing health equity, diversity, and inclusion within their organization, among their members, and within the broader health system. They work to identify and eliminate barriers for people and communities at risk of poor health, with a special focus on Indigenous people, Francophones, racialized and Black communities, and Two-Spirit and LGBTQ+ communities. Congratulations to the 2020 Excellence in Diversity and Inclusion Award recipients, the Alliance for Healthier Communities. They are the voice of a vibrant network of community-governed primary healthcare organizations that serve diverse, often marginalized, and underserved communities across Ontario. Congratulations.
On behalf of the board, staff, and over 100 community-governed primary healthcare organizations, the Alliance for Healthier Communities would like to take this moment to thank the Canadian College of Health Leaders and our award sponsor, Sodexo, for recognizing us in our 2020 Excellence in Diversity and Inclusion Award. With the challenges faced by marginalized people during the COVID-19 pandemic, this is particularly a poignant time to recognize our work in health equity. Our members work hard in ensuring that the voices of marginalized people are recognized, especially right now with the Black communities and other marginalized populations, to seasonal farm workers, to people who live on the street and are faced with an overdose crisis, to people who need to have access to digital equity in order to get virtual care. These are all the kinds of things that our members are doing every single day to recognize and work on health equity for these populations. As we plan for post-COVID recovery, it is particularly important that we continue our fight in equity as we look for more inclusive and diverse communities, as well as ensuring that we fight systemic racism in health, education, justice, and governance. Thank you again for recognizing our work in health equity as we continue on our journey to improve the health and well-being of everyone in Ontario.
Adriana, congratulations to you and your team on your achievement and award. I think we can all agree this is such a historic opportunity to create a more inclusive, just, and equitable society that will impact so many people. The Excellence in Patient Experience Award is focused on honoring organizations and individuals who have set in place innovations that improve the human experience in healthcare. The award highlights and recognizes innovations that have made a change to how patients and their families experience healthcare services. Thank you to Huron Studer Group Canada for sponsoring this award, which was presented for the first time last year.
Greetings from beautiful St. John's, Newfoundland. It's my pleasure to present the 2020 Excellence in Patient Experience Award. Huron Studer Group is a mission and values-driven firm. We partner with organizations to accelerate their journeys to excellence. Together, we achieve results, ultimately making healthcare better for employees to work, physicians to practice, and patients to receive excellent, compassionate care. We believe a strong and consistent focus on excellent patient experience is more than just the right thing to do. An abundance of scientific evidence supports excellent patient experience as an imperative to drive improved outcomes. This year's recipient of the Excellence in Patient Experience Award is transforming how patients, caregivers, and families experience the delivery of health services. With innovation and commitment to operating as one seamless system, both within and beyond their walls, our award recipient partners with patients to co-design integrated, coordinated care plans. Congratulations to this year's winner, Hamilton Health Sciences.
Hi, I'm Rob McIsaac, President and CEO of Hamilton Health Sciences. Firstly, let me thank the Canadian College of Healthcare Leaders for this recognition. We are very grateful for it. Thanks also to Huron Studer Group of Canada for sponsoring this award. The work that we did around this award originated from our strategic plan, which said we wanted to take a population health approach. And we had a great group of staff here who got to work thinking about how we could try to bend the demand curve for healthcare down here in the city of Hamilton. We devised this program to help people who most frequently fall through the cracks of our healthcare system. And the program has made a big difference in people's lives. So we're extraordinarily proud of it, and I'm very proud of our team who developed it. Thank you very much.
The Excellence in Patient Safety Award recognizes individuals and teams who are committed to improving patient safety within the healthcare environment through leadership, culture, best practices, innovation, and change management expertise. Ce prix rend hommage aux individus et aux équipes qui se sont engagés à améliorer la sécurité des patients dans le milieu de la santé par le leadership, la culture, les pratiques exemplaires, l'innovation et les compétences en matière de gestion du changement. Thank you to BD Canada for sponsoring this award.
BD is a leader in patient and healthcare worker safety, and we partner with organizations around the world to address some of the most challenging global health issues, like medication safety and antimicrobial resistance. BD is proud to sponsor the college's Excellence in Patient Safety Award. We are delighted to honor a team that has demonstrated leadership in reducing the rate of harmful falls by 30% across various inpatient clinical units. Through education to staff and community members, the Falls Prevention Project has been instrumental in not only achieving but maintaining a steady decline of falls causing harm in the organization, but it has also provided a forum to capture and include the patient, caregiver, and family voice. I am pleased to announce Markham Stouffville Hospital as the recipient of this year's award. Congratulations.
It's an honor to accept the 2020 Excellence in Patient Safety Award. On behalf of everyone at Markham Stouffville Hospital, I would like to thank the Canadian College of Health Leaders and BD Canada for such incredible recognition. Providing safe, high-quality care is at the heart of everything we do at MSH and a central part of our Honored to Care culture. Our Falls Prevention Project is an excellent example of this philosophy in action. Central to our project's success was our Falls Prevention Working Group. Due to their hard work and dedication, our falls prevention strategy has fundamentally impacted patient care across many clinical areas. We are fortunate to have an incredible team of staff and physicians who took the falls prevention program to heart and worked every day to put it into action. I am proud to work alongside such a talented and passionate group of healthcare professionals. Thank you.
The recognition in delivering value-based healthcare aims to increase the profile and understanding of value-based healthcare by honoring an organization or team that is deliberate in changing the way that care is delivered, resulting in improved patient outcomes. This means that patients are being optimally cared for at the right time, in the right setting, and at the right cost. Our sincere appreciation to Medtronic Canada for their support of this recognition.
Medtronic Canada is proud to support the Canadian College of Health Leaders National Awards Program again this year. We're pleased to announce that the recipient of the recognition in delivering value-based healthcare is the Surgical Team Total Joint Replacement Program at the Women's College Hospital. To shift a traditionally inpatient procedure to outpatient care, the team developed an innovative anesthesia protocol as well as a virtual care program. This initiative allows patients to recover in the comfort of their own homes with their families. It demonstrates value-based healthcare by improving outcomes that matter to patients while helping to alleviate some of the cost burden on the hospital system. They were able to leave hospital beds open for patients in need of acute care. Congratulations to the Women's College Hospital team. Thank you.
I am proud to accept this award on behalf of the team for the Outpatient Total Joint Program at Women's College Hospital. An interdisciplinary team came together to develop this innovative program to support the shift of traditional inpatient care to outpatient care. The aim of this unique collaboration was to deliver effective, efficient, and patient-centered care for individuals with hip and knee arthritis. Using virtual care, we were able to monitor and support patient recovery at home. Our team played a vital role throughout this journey process. Patients are active in their care throughout the journey and are followed postoperatively through video conferencing. Our goal was to do 10 total knees and 10 total hips. We now perform 152 joints per year. As an academic ambulatory center, we are committed to sharing our learnings across the health system. On behalf of Women's College, we would like to thank the Canadian College of Health Leaders, Medtronic, for their generous grant in recognition of value-based care.
We have been celebrating and showcasing the success of the recipients of the 3M Healthcare Quality Team Awards since 1994. It has been tremendously rewarding to see quality take its permanent place on the agenda of healthcare leaders, and we thank 3M Canada for their continued support. Today, we are delighted to honor the recipients of these awards as part of our Honoring Health Leadership video ceremony.
The 3M Healthcare Quality Team Awards celebrate innovation, quality, teamwork, and patient and family engagement. Given the continuing challenges we all face in healthcare, it is vital that we take time to celebrate and to learn from initiatives that use creative thinking and collaboration as effective tools to improve the delivery of programs and services that result in sustained changes within organizations. Although we are honoring 2 special initiatives today, I would like to thank all those who submitted nominations. Every year, our selection committee have the enormous tasks of reviewing and ultimately choosing only 2 programs for special recognition. The 3M Awards booklet on the CCHL website includes summaries of all of this year's nominations. I encourage you to read it and to consider how these initiatives could be implemented within your own organizations. The 3M Healthcare Quality Team Awards are presented in 2 categories: quality improvement initiatives across a health system and quality improvement initiatives within an organization. It gives me great pleasure to announce Mackenzie Health as the recipient in the Quality Improvement Initiatives Across a Health System category.
Thank you to the Canadian College of Health Leaders and 3M Canada for this award. Mackenzie Health worked hard to significantly reduce the time it takes for our stroke patients to receive life-saving medication after arriving at hospital.
Our first in Canada Epic Enterprise electronic medical record automated many paper processes and reduced this time from 53.5 to 34 minutes.
Our dedicated group of clinicians and staff further refined the process, and the time decreased to 27 minutes. This is one of the best organ needle times in Ontario. As a result, more than half of our patients are going home without any impairment at all.
This incredible achievement would not have been possible without the support of an integrated team, which included members from the stroke team, neurologists, physician leaders, strategy consultants, clinical informatics, utilization and analytics, medical imaging, emergency department, York Paramedic Services, and the Mackenzie Innovation Institute.
Thank you again for recognizing Mackenzie Health with this award.
I'm also pleased to announce that the 2020 recipient of the 3M Healthcare Quality Team Awards in the Quality Improvement Initiatives Within an Organization category is Island Health.
On behalf of the entire Island Health team and the cardiac surgery program in beautiful Victoria, British Columbia, we would like to thank both the Canadian College of Health Leaders and 3M Canada for the honor of receiving this award.
Many stakeholders needed to be engaged for the sustained success of this quality improvement initiative. We would like to thank our patient partners, the Heart Health Quality and Leadership team, the Surgical Services team, the Infection Prevention and Control team, as well as the research team.
Lastly, we want to give credit to the REDCap data management system, which we rely on to track each identified surgical site infection patient encounter. The system was essential for allowing us to pivot from a static, simple Excel-based model to a more dynamic system, giving us the ability to reliably track key patient information in a secure environment and to intervene in a more timely, effective manner for our patients.
Thank you very much for this honor. It is validation that we can implement change initiatives that sustain positive impacts on our patients' experience with a commitment to quality improvement in all aspects of the daily work we provide.
For over 6 decades, Johnson & Johnson has been recognizing outstanding talent within Canada's Master of Health Administration programs. Every year, we are privileged to welcome the recipients of the Robert Wood Johnson Awards into our community of health leaders. As the college's past chair and a former Robert Wood Johnson Award recipient, I would like to thank Johnson & Johnson medical device companies for their continued support and take this opportunity to congratulate all the winners.
Thanks, Faisal, for that very warm introduction and for the invitation today. On behalf of Johnson & Johnson, I'm delighted to recognize some up-and-coming difference makers. Established in 1956, the Robert Wood Johnson Awards are presented to 6 students from Canadian universities offering a Master's of Health Administration. Recipients are selected by their respective faculty for their individual achievements and promising contributions to health services management. Congratulations to this year's Robert Wood Johnson Awards recipients. These individuals are joining an exclusive group of health leaders poised to positively affect the way health is delivered across Canada. We look forward to following their careers. Without further ado, the first award. Congratulations to Peter Richard from Dalhousie University. Peter Richard obtained his Bachelor of Science in Biology from Dalhousie University before obtaining his Master's of Health Administration at the same institution. He completed his MHA residency with the Occupational Health and Safety Unit within the Regulatory Operations and Enforcement Branch at Health Canada. Congratulations, Peter. Félicitations.
I am both honored and excited to receive this prestigious award. It would not have been possible without the help and support of a few individuals. First, I want to thank the School of Health Administration, its faculty, and its staff. Their dedication to both the field and student learning ignited a passion within me and inspired me. Next, I want to thank those who further enhanced my learning and helped me develop the skills needed to be a healthcare leader. This includes my peers who studied alongside me, the Dalhousie Faculty of Health, and the Nova Scotia Health Authority. Being able to collaborate with my peers and working with them on various projects taught me valuable skills, both professional and personal. I want to also thank my family. Their unwavering support over these last 2 years and their consistent words of encouragement have truly shaped me into the person I am today and have helped me navigate my career path. Without them, I wouldn't be accepting this award. Lastly, thank you to Johnson & Johnson Medical Devices Companies for sponsoring this award. I'm looking forward to the future and I'm excited to be part of positive change. Thank you.
And on to our next award recipient. Congratulations to Yvonne Huang from the University of British Columbia. Yvonne graduated with a Bachelor of Science in Pharmacy in 2013 from UBC and completed her pharmacy residency with the Lower Mainland Pharmacy Services in 2014. She has primarily worked as a clinical pharmacist at Surrey Memorial Hospital in the emergency department. Since starting the UBC MHA program, she has transitioned into an interim position as a pharmacy dispensary parenteral services supervisor. Congratulations, Yvonne.
Firstly, I would like to thank Johnson & Johnson for their sponsorship of the Robert Wood Johnson Award. It is an absolute honor to be one of this year's recipients. Like many distinguished recipients before me, I am taking a pledge to make a difference in the way our healthcare system is delivered. The last few months have shown me that as we navigate through these unprecedented times, challenging the status quo on healthcare delivery has never been more important. Pursuing the UBC MHA program has been one step towards achieving that goal. For that reason, I would like to thank all the instructors of the program administrators, Nick Bansbeck, Wei Zhang, Steve Morgan, Charisse C., Gina Abernathy, and all my colleagues in the MHA cohort for their support. You have all left a positive and indelible mark on my experience. To my colleagues, it has been a pleasure learning from and learning with the leaders of the future. And from what I've seen, I can attest that the future is bright.
Congratulations et félicitations à Lucy Schneider from Université de Montréal. Lucy Schneider began her career by studying nutrition at the Geneva University of Health, graduating with a Bachelor of Science in 2015. She then worked as a clinician in various healthcare institutions in Switzerland for more than 2 years. She undertook a master's degree in Health Services Administration at the Montreal School of Public Health. Encore une fois, félicitations, congratulations, Lucy.
Hello everyone. I would like to sincerely thank the Canadian College of Health Leaders, the Johnson & Johnson Company, and the University of Montreal. I'm truly honored and I will try to be worthy of the Robert Wood Johnson Award. From my university and professional experience, I have learned the importance of several elements about our field of practice. To this day, the one that I think essential are recognition of each other's work, trust, agility, and openness. For my future practice, my objective is to continue to learn, to keep up to date with innovations and development in our health systems, and to contribute to its improvement. Merci, et merci particulièrement à mes professeurs et mes collègues de l'Université de Montréal qui m'ont vraiment beaucoup fait grandir ces 2 dernières années. Je me sens outillée pour affronter les enjeux futurs, alors merci.
Congratulations to Jordan Baldry from the University of Alberta. After graduating with her Bachelor of Science in 2018, Jordan decided to pursue a graduate degree in public health as a way to combine her interests in psychology, health, project management, law, and philosophy. As a recent graduate of the University of Alberta, Jordan is working as a project coordinator for the Provincial Health Services Authority, or PHSA, in British Columbia. Congratulations, Jordan.
First of all, thank you to the Canadian College of Health Leaders and Johnson & Johnson for presenting me with this award. I am humbled and honored to be receiving this award along such dedicated and inspiring individuals. My hope is that as time goes on and the world becomes more complicated, that we can all exhibit good judgment, reliability, and resilience so that meaningful changes to health services can occur. I'd like to thank my family and my mentors for their advice and for supporting me in my pursuits to study and be involved in health services. I could never have imagined all of the experiences that I have had over the last couple of years, and these people have been a constant source of encouragement and positivity. Lastly, I'm excited to keep learning and to contribute to the health of our populations.
Congratulations to Anya Marion from the University of Ottawa. After a few years of providing maternal and newborn care as a registered midwife, Anya shifted her focus to the challenge of reducing burnout rate for healthcare providers. Anya attended the Telfer School of Management Master of Health Administration program at the University of Ottawa to build her leadership toolkit in order to tackle this challenge. Anya is now an HR business leader at the Ottawa Hospital. Congratulations, félicitations, Anya.
I am so honored and grateful to be one of the recipients for the prestigious Robert Wood Johnson Award. The person this award was named after, Robert Wood General Johnson II, was a politician, writer, sailor, pilot, activist, and philanthropist, as well as an advocate of the specialized training for hospital administrators. Without his advocacy, I would not have been able to attend the Telfer School of Management at the University of Ottawa. By completing my specialized education, I now have a solid grounding in business management and understand the key challenges in the healthcare system. Thank you to the Telfer School of Management for nominating me for this award. To the faculty at Telfer, thank you for helping me build my leadership toolkit. I am so excited to leverage the skills and knowledge you have taught me. The people who have supported me as an emerging women leader, I thank you for your encouragement, support, and valuable feedback you have provided me. Your guidance will help me navigate my career in healthcare management. Finally, I want to acknowledge my amazing fellow recipients of this award. Although I have not had the opportunity to meet you yet, I hope to in the future. Your incredible accomplishments in your healthcare careers thus far inspire me. I look forward to watching you in your careers, and in the future, perhaps we can collaborate on projects that improve the Canadian healthcare system.
Congratulations to Phoebe Smith-Chen from the University of Toronto. Phoebe Smith-Chen is currently Program Lead of Patient Experience at the Ontario Hospital Association. Previously, Phoebe worked in patient experience at Michael Garron Hospital in Toronto and was a speech-language pathologist for over 10 years in rehabilitation, palliative care, and acute care settings. In addition to her University of Toronto IHPME Health Administration degree, Phoebe holds master's degrees in bioethics and speech-language pathology, and certificates in health law and leadership. Congratulations, Phoebe.
Every day, countless teams, patients, clients, caregivers, and learners come together to work tirelessly for Canadians' well-being. It's not always easy, and those who do it are devoted to making a difference. Most significantly, we cannot do it alone. It's the collective magic that makes it happen, like truly listening or leveraging each other's strengths towards bold change. Robert Wood Johnson exemplified this as an early visionary with a legacy that remains strong. Thank you to Johnson & Johnson, CCHL, and IHPME faculty for this incredible honor. While this award is presented to individuals, it represents a shared effort from so many. I was fortunate to learn from a previous recipient of this award. She mentioned that even several years later, she views it as a North Star that inspires her to drive change for those who need it most. I promise to never lose sight of that collective magic. Thank you again, and congratulations to my fellow recipients. Much love to my family, classmates, and faculty.
Congratulations to all of the 2020 award winners recognized in our virtual celebration. Your achievements and leadership are so impressive. Thank you for making a difference. It's been a delight to host the ceremony and to hear from such an inspirational group of leaders.
Félicitations à tous. As evidenced by the testimonials we have seen, our healthcare systems are being led by extraordinary individuals whose passion and expertise will have long-lasting and positive impacts on patient care in this country.
We encourage you to consider nominating individuals, teams, and organizations worthy of recognition in next year's 2021 National Awards Program. For nomination information, please visit the awards section of the CCHL website.
At the college, we're committed to bringing the best possible leadership to the best care for our friends, family, and loved ones. As we navigate these uncertain times, and as we celebrate our 50th anniversary, we are positioning ourselves as a bigger, better, bolder college going forward. I want to add my personal thanks to 3M Canada and Johnson & Johnson as generous co-sponsors of this awards celebration. We are proud of our past, confident in the present, and excited about the future, and we look forward to seeing you next year. Mesdames et messieurs, merci et au plaisir de vous voir l'année prochaine.